He's gonna make it clear. Did you know? Come on, listen here. Did you know?
Hello, welcome to the Did You Know Show. My name is Brian Green, and today we focus on the twin sister docs. Let me just tell you, the Did You Know Show is centered around connecting people to home, community, and business resources that you ordinarily wouldn't know about. And today it's my esteemed pleasure to introduce or reintroduce you in some ways to the twin sister docs. We have Elena and Delana. And it's funny, that's a side story. I'll tell you about that later. But Dr. McDonald and Dr. Warlaw, who are two doctors in the Philadelphia area who have two different really specialties, but they have a story to tell. And I am going to stop talking, and I'm going to ask you ladies, one by one, what was it that led you to being a physician? Dr. McDonald, you go first.
Yes, so thank you for having us.
Thank you for coming.
So I initially thought I was going to be an attorney.
Oh, wow.
Yes, and I got a job through the Parks and Recreation or the summer job program in Philadelphia, and I'm dating myself, but I was a file clerk
Okay.
down at a law office.
Okay.
And I would literally answer the phone, take messages in a message book, file the things in the file cabinet, take some things down to City Hall to be filed. And towards the end of the summer, I was like, I don't think I want to do this because it's a lot of paperwork. Little did I know, right? The irony. And really what it boiled down to for me heading off to college was, what do you like? And really, I knew I wanted to help people and I like children. And I said, medicine is the best way for me to help people, help children, and really make a difference in people's lives. So that's how I landed in medicine. But it wasn't my first choice.
It wasn't your first choice. Dr. Warlaw.
So medicine wasn't my first choice either. I initially thought I wanted to be an elementary school teacher.
Interesting.
Yes, so we're proud products of the Philadelphia School District. We graduated from the Central High School, class of 251.
246, just to say.
251, the best class.
And so we had, Dr. McDonald and I, we had such a great school experience. Our teachers had such a profound impact on us. And so naturally, I thought I wanted to be a teacher. But then, you know, as you go through your journey, you realize your skill set. I realized I was great at math, I was good in science, and my trajectory started to change a little bit. But the key thing that really piqued my interest in medicine was that our maternal grandmother died at the age of 53 of breast cancer.
Okay.
We were 8 years old when she died. We didn't know what she died of. We didn't know that she had both her breasts removed because of mastectomies. But when we just knew that grandma died. And when we got to high school, my mother let us know that grandma died of breast cancer, and she was only 53 years of age. At that point, I decided I wanted to help people live longer lives.
Now, Dr. Warlaw is in internal medicine.
Family medicine, yes.
Family medicine, excuse me. And then Dr. McDonald is the pediatrician.
Yes.
All right. So tell us about the Twin Sister Foundation. What was the precipice of that? What was the vision? How did it come together? Walk us through it. And I know you have the 3 T's in the mission, so don't leave that out of the story.
Okay.
Come on, tell us about it.
So the Twin Sister Docs Foundation was really birthed out of the idea of people would always come to us and say, can I ask you a question? Because I really don't feel comfortable talking to my doctor. And we would always say, well, that's problem number 1. You should always feel comfortable talking to your doctor. And so Dr. Warlaw and I started to realize that we were doing great work in our practices, but there was a need outside of the practice. So we wanted a bigger reach. We wanted to reach people in the community, locally, regionally, nationally, and just arm people with the information that they needed to go talk to their doctor. You don't need to be in the medical field to get great medical care. So our goal was to really teach people how to advocate for themselves. So we may not be your doctor, but we're giving you the information that you need to go have a conversation with your doctor. And that's really how Twin Sister Docs was birthed. And ironically, we started January, February of 2020.
Wow.
And we started doing things on Facebook Live. We would be talking about you know, diabetes, do you know your numbers, do you know your A1C, do you know your blood pressure, do you know your cholesterol, talking about heart disease, talking about the importance of mammograms and colonoscopies. But then we all know what happened in March of 2020.
Whew.
The world literally shifted as we were dealing with COVID.
Right.
So for a few years, that was 99% of what we talked about because so much was going on with COVID. But we realized that we wanted to reach people who felt like they weren't being heard and weren't being seen. So that was really our goal.
And you know, it's interesting as I sit here and think about me, using everything about me and centered around me. I'm at that age where a lot of my friends, we talk. It's interesting. Our conversation has branched out of sports. Nowadays, we're talking about sleep apnea. We're talking about health issues. You just mentioned a few of them. High blood pressure, diabetes, cholesterol issues. What's your triglycerides?
Yes.
That was never something that we talked about freely. And something else you said, too, that just struck a chord with me, because ultimately, when you get in front of the doctor, the last thing that you want to do is be health shamed.
Yes.
And you don't want to be, you know, you don't want to feel that vulnerable or stupid or made to feel like, you know, you're going to die. Nobody wants to hear, if you keep eating that watermelon and pineapple, your foot is going to get cut off. You know, yeah, you know, because, you know, now when we grew up in a time where medicine was, in some ways, we thought about it as the end. You didn't think about it as practicing medicine to extend your life and to live a better, more healthier life. You know, it's interesting, too. I was pulled into this panel discussion. We put it on blast. I was pulled into this panel discussion with Dr. Wardlaw, and it was funny. We were talking about specifically men's health issues. You know, and so your part of it was, you know, from a family medicine perspective, you know, giving us feedback on what we should be doing and what we should be asking. Do you remember it? What did you like about the panel discussion?
Well, I like the panel discussion because, one, it was geared towards men. We know that in my practice, and in a lot of physicians' practices, men don't come to the doctors a lot.
Well.
They come when things are on their last leg. Mm-hmm. And unless they have someone encouraging them, a wife or a significant other, pushing them to go, we lose a lot of men between like the ages of 18 and 35 because they don't have anybody pushing them to come to the doctors. So to have that discussion, we don't only want to see you when you're sick, we want to see you when you're well as well. Preventive care is huge. How do you know if you have high blood pressure if you don't go to the doctors? How do you know if you have diabetes if you don't get the test checked? How do you know what your cholesterol looks like if you don't get the test checked? How do you know if you have polyps in your colon if you don't get a colonoscopy? Mm-hmm. So again, that conversation was so important because we had a audience of men who were there in tune, and they were engaged, and they were asking questions, and to let them know it's okay to come to the doctors and say, hey, I'm here to just get checked out, or I'm here because I have this issue, but we don't want to just see you when there is an issue going on.
You know what? Let's stop right here. Let's take a quick break, and we're going to come back on the other side and continue our conversation about maintenance, health maintenance, whether it's about women or men, maintenance. Please do not go away.
Did you know?
It's growing again.
These caregiver deserts are everywhere. It's slowing down. It's almost stopping.
It's stopping right around Philadelphia.
What's happening on the ground? It seems like Always Best Care is fighting back. How?
Ride sharing, gift giveaways, job security, promotion opportunities, competitive pay.
That's amazing. I want to work there.
Then you should apply too. Join Team Green today.
Hi, I'm Elizabeth Green. I'm a retired nurse, and Always Best Care takes care of me in my own home.
Hi, I'm Brian Green, the owner and CEO of Always Best Care. We service southeastern Pennsylvania and the entire state of Delaware.
Do you want them to know that I'm your real grandmother?
Yes, Chubby, that's the point.
Should I tell them the time when you were 7?
Love, no.
I could stay in my own house and get all the help that I need, and I tell you that all the time.
You see, I trust my people with my grandmother, and you can trust us with yours.
Did you know? Come on, listen here. Did you know?
Welcome back to the Did You Know Show. I want to remind the viewers that you can check me out on Saturdays at 4 p.m. on WURD FM, 96.1 FM or 900 AM, Saturdays at 4 o'clock. live. And so I'm returning right back to the conversation with my really good friends, fellow Central alumni.
Yes.
And we were talking before we left the break. We were talking about men's health and preventive maintenance and that kind of thing. And I wish, a lot of times, I wish we could do the outtakes on these shows because we have so much spirited conversation. But getting back to that, I revealed that I have a really close frat brother, Omega Psi Phi fraternity, if you're wondering, that routine maintenance just found out that he has mass. And the doctor says it's probably an 85% chance that it is cancer. And so they're going to schedule a surgery. And so I also had a frat brother that died a few years ago from pancreatic cancer. And on his deathbed, he made us promise that we will all get screened and ask for the CA19 test, I believe it was. And I didn't know nothing about no CA19 test, nor did I know that you could ask for a doctor to test you. So, when you go to these visits, it's kind of for us as patients reactive. You're kind of listening to what they say, if you have a diagnosis, if you're adjusting your meds, what has happened since the last visit. But you never have the proactive knowledge to ask. Like, okay, well, can you test me on this? Can you test my T cell count? Can you test the protein in my urine? All these lab reports, I know about my A1C and that kind of thing, but you can absolutely ask your doctor. You can engage with your doctors. And the more we talk about it as human beings, whether we're men or women, it's funny. It's like anything else. Once one person shares their story, the next thing you know, it's like, oh,
that happened to me.
I had that side effect to this medicine. And, so from your perspective of that, let's just round this conversation into how important, let's really speak to the pediatric side and to family medicine side, how important it is to get tested, especially if things are hereditary. What do you think? What did you say?
So as a pediatrician, we always say there are certain things that's going to be tested for right out the gate. Before your baby leaves the hospital, a test called a newborn screen is done.
Okay.
Where they are testing for things that you are born with and there's a treatment for. So not necessarily a cure, but a treatment for. So things like sickle cell disease and cystic fibrosis and hypothyroidism, certain things, PKU, a lot of metabolic diseases. So certain things that you're born with, and we don't necessarily want to wait for symptoms to show up. We know you have it, let's jump on board and start the treatment now.
Right.
Versus other things that are going to show up in life. You're not born with asthma. That may show up later on in life, but if you have a family history of asthma, that's going to increase your risk of having it. So it's important to have a conversation with your doctor if you're having concerns about your child. And I always tell people, listen, this is a baby, this is a toddler, a teenager at some point, but this is the most important job that you will ever have in your life. No matter how many get ready for the baby, how-to manuals you read, you're never quite ready. And this baby is 1,000% dependent on you. You don't want to mess it up. We don't want you to mess it up. If you have any questions, please ask us. And then sometimes, as Dr. Wardle always say, some people don't know what to ask. So it's our job to give you information that you don't know that you should know or what you should be looking out for. So it is a conversation, and some people may come in and you may say, hey, can I get this particular test because I have a family history of this? Or I have a friend who had this, so I'm wondering, should I get that test? So it's starting a conversation that you have with your physician. Now, sometimes people come in and say, Doc, test me for everything. And I'll say, or test, I just want you to run blood work on my child. And my response will be is, tell me what you're concerned about. And then I also say, our testing really depends on our history and our physical. Because the book of tests is like this.
Wow.
So we have to narrow that down based off of history and physical and family history. So all of those things are important, but it requires a conversation. And you should never feel uncomfortable talking to your doctor. Two people you don't lie to, your doctor and your attorney, okay? There should be no judgment zone when you talk to your doctor, right? We have seen a lot, we have heard a lot. Nothing I tell my families, nothing you tell me is going to surprise me. But you have to tell me so that I can figure out how to help you, right? So that's important.
I'm going to add to that. When you go to the doctors, you have to give them the information because when you walk in, just like Dr. McDonald said, test me for everything. That does not help us. Now there are some things that we traditionally test for, but if you are having signs, symptoms, concerns, then you need to provide that information so that we can tailor our evaluation plan. So please, you have to help us to help you put the pieces of the puzzle together. So please give the information. Don't let it be, oh, they'll find out when they check the blood work. Well, we may not check for a certain thing if we are not aware that you may be experiencing that. So please make sure that you have the conversation. And as Dr. McDonald said, one of our biggest missions is to make sure that people can at least have a conversation. What is my condition? Like, what is going on here? So you can, when we get to the end of the visit and the doctor says, do you have any questions? It's not that patients don't know. It's just that they're not sure of what to ask.
Right.
And Dr. McDonald and I say, listen, we know medicine because that's our craft. But when we go to the mechanic, we may not know what to ask when we go to the mechanic.
How about
No,
that?
we don't know. We don't know what to ask,
And
right?
so, if you don't hear anything else during this conversation, please don't feel like you have to figure everything out when you go to the doctor's office. But you do have to provide information and give all the information so that the doctor can tailor the plan accordingly and the assessment accordingly.
You know, it's interesting. I always bring stuff back to me. As you were talking about, test me for everything.
Test me for everything.
So I've gotten to the point now where my doctors, with modern medicine now, they send your lab result, well, your lab requests to either, LabCorp or Quest. We'll talk to one of them.
Yes.
And so the last time I went, before I had my primary and my nephrology appointment was within a week of each other. So just as it turns out, I show up to LabCorp, and I'm sitting there with my arm. They took out like 5 tubes of blood. I said, well, how many tests am I getting? So then I know I'm not the only one who thinks this way. I'm thinking, well, am I sick and they're just not telling me? Like, what's going on?
Yes.
And then they want me to pee in the cup. You're going to take 5 tubes of blood? And the whole time that my meeting with the doctor, now it's become not an appointment. It's a whole meeting, because now I do have questions.
Right.
I got questions, because I'm like, well, y'all took 5 tubes of blood, but then I got the report. Some health systems, which is very helpful, have the MyChart system. So you can look and you can read at your own leisure and really look stuff up. And they got this wonderful thing called WebMD that you can go out there and try to understand it so that you come in there and you can have that proactive conversation with your doctors. And it also shows your doctors that you're really in tune. Because my doctor's attitude towards me has changed a little bit. Not because I'm trying to know his job, but I am absolutely a steward of my health. And now when the check engine light comes on, I can say, hey, you know what? Frequent urination through the night has increased or decreased. And we used to say different drugs, and we go through my list. I say, no, check this one, that one. I have a better understanding. So when you have a friendly doctor, because at the end of the day, you're paying them. And I got the twin sister docs on here because they seem like doctors that spend time with you. Because we do have some doctors that rush you in and out. But when you have a doctor that is willing to take the time and really talk to you, you want to utilize them. I want to push the conversation to the mission.
Before you do that, Brian.
Go ahead, come on with it.
You said,
These
some
portals
some doctors rush you. The 15-minute visit really does not exist. Now, let me tell you what they want us to do on a 15-minute visit. They want us to interview the patient, examine the patient, come up with an assessment, come up with a plan, and close the electronic chart. How can we do that effectively in 15 minutes, Mr. Green?
You really can't.
So, again, the way the system is set up, we naturally are running behind. Either the doctor is going to come in and rush you, and you're going to feel rushed, or the doctor is going to come in and take time, and then we are running behind schedule. So please give us some grace.
Yes.
Thank you.
We're not trying to make you wait purposely, right? We're trying to make
That's a
sure
good
everybody
point.
gets the
My doctor's
care.
always behind. He's always behind, but I wait patiently.
Yes.
Because he does take his time.
when he gets there, right?
He does.
That's the key thing. And one other thing, be careful about checking those portals and those labs. Because sometimes what we know as doctors is you may check your lab before your doctor checks your lab, right?
Okay.
Now, if it's a Friday night, you worried all weekend.
You ain't never lied.
Because that thing said is abnormal, but when you really talk to your doctor says, no, I'm not concerned because it's 1/10 of a point higher. So it's okay. But now you're stressed, you're worried, you're concerned, and then of course, good old WebMD and Dr. Google, will have you go down a rabbit hole. So you just want to be careful when you do those things.
Thank you. Thank you.
When you do those things.
Yeah.
But of course, you want to know, hey, doc, okay, can we talk about my A1C? I saw it came back, you know.
Right.
What's the deal? Is up, is down? Do we need to do anything? Because you said you want to have a conversation with your doctor, and you want to have the information that you need.
Right on. You know, so when your check engine light comes on, the moral to the story, when your check engine light comes on, whether you have kids or you're an adult, go see about it.
Please. Yes.
Go see about it.
Yes.
So let's get back to the Twin Sister Doc Foundation. You guys have a mission that has 3 T's.
Yes.
Let's talk about it.
Yes.
So our 3T mission is trust, translate, transform. Trust. Dr. McDonald and I, we're trusted messengers. We have the unique experience of growing up in the communities that we serve. And so we understand the challenges that the community members face. And so we can address them accordingly. So as trusted messengers, we are delivering trusted information, accurate information, culturally sensitive medical information. That translates into patients being able to become active in their health care, being able to have conversations with their physicians, being able to ask the questions and really following up on conditions and situations. And then that translates into transformational outcomes and hopefully better health outcomes for individuals, and then that expands to communities and exponentially.
Yes. And
Wow.
we say trusted messengers because trusted messengers is very important, because we know certain groups, certain ethnic groups have a mistrust of the medical establishment. And African Americans have a huge mistrust, and that mistrust is for a reason, for
Right.
historical events that has happened in history. So when people revert back to those events, and even sometimes things that happen today, you go into the hospital and you're dealing with things like implicit bias. People make assumptions about you just because they see you, right? And they make these assumptions about you, and that goes into the wrong direction. So we want to make sure that we are reaching those people who, again, may have some trepidation. And Dr. Wardlaw always says, don't let historical events prevent you from getting the health care that you need today. So we go out as trusted messengers, and we understand the mistrust, we understand the trepidation, but we're also here to explain to you why you need to go to your doctor. And if you don't feel comfortable with your doctor, then it's time to find a new doctor.
Wow. I'm sitting here and I'm thinking about, you know, I know that we're interviewing the twin docs, but everything you say is kind of striking a chord with me personally. But we ain't got enough time to go through that. But we are going to take a quick break, and we're going to come back on the other side and continue our conversations with the twin doctors, Elena and Delana.
Yes.
All right, do not go away. This is really going to get good.
Yummy.
Yummy.
I don't know about you, but I'm getting out of this nightmare. No, 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 no.
It's okay, Miss Orwell. You're safe at home. You were just having a bad
Nightmare. Oh, thank goodness, Julia. I love my always best care.
Did you know? Come on, listen here. Did you know?
Welcome back to the Did You Know Show. My name is Brian Green, and I'm here with Dr. Wardlaw and Dr. McDonald. And if I could just do the outtakes, I might have to do a whole episode on outtakes, because the conversations that we have are so meaningful and so spirited. But as we bring back the conversation, I want to ask your opinions on vaccinations. There's a lot of conversation these days about vaccinations, and I can tell you, I remember very clearly having to get vaccinated when I was a kid, and I came through the public school system for MMR, mumps, measles, rubella. It was just something that you did. You didn't question it. People that join the Army, it's my understanding, they have to take several vaccinations because there's a chance that you might travel all over the place. All of a sudden, you have some folks believing and really steering the conversation to demonize vaccinations, which personally, I don't think is correct. But as physicians, what do you feel about vaccinations?
So as a pediatrician, I professionally 100%, 1,000% endorse vaccinations. Vaccinations is probably one of the greatest medical advancements of the 20th century. And vaccines are important because vaccines have been able to prevent severe complications and death of certain diseases. And we know that if we can prevent the spread of these diseases, and if the disease should spread, we can prevent the complications, then that is huge. We have seen vaccines work, whether or not we recognize it or not. So, Bryant, you know, you're in your mid-50s, so I'm sure you've seen plenty of people with chickenpox. Right? Now,
Yes.
now, how many times have you seen chickenpox in the last 15, 20 years?
Not often.
And you know why?
Why?
The vaccine program. We have a vaccine for it, right? Now, when we use the vaccines to eradicate certain things, polio, right? Let's go to measles, mumps, and rubella, MMR, because that is huge. And we've been seeing lots of cases of that. The MMR vaccine has been out for well over half a century. It is safe. It is effective. One thing about vaccines or any medication, any treatment that we are recommending to you in the medical establishment should be safe and effective, whether or not it's vaccines, antibiotics, Tylenol, Motrin. If the benefit does not outweigh the risk, we should not be having a conversation. Vaccines go through rigorous clinical trials to, again, prove that they are safe and effective. We had effectively measles, mumps, and rubella significantly decreased the cases. But now we're seeing them pop up significantly because what has happened is we're seeing more and more people opt out of vaccines. We see certain communities who opt out of vaccines. And then we start to see these diseases come back. It's not that these diseases are completely gone. It's just that we have a very, very, very effective way of combating them, and that is vaccines. So as a pediatrician, I wholeheartedly recommend vaccines because we have seen them work. The data proves it.
So as a family medicine physician, I too endorse vaccines. And so we do know that there can be side effects from vaccines. You know, you may have some body aches, you may have some fevers, you may have some, some unwanted side effects that you may have. However, we also know that, again, the benefits outweigh those. And those side effects are typically temporary. Now, we do know that there are some side effects from vaccines that can be more serious, which the CDC has been very transparent about. You know, even with the COVID vaccine, you know, there were some cases of myocarditis or inflammation around the heart, which we saw in younger males. There were some cases of Guillain-Barré syndrome, where the nervous system is attacked by the autoimmune system. And so we saw some cases of blood clots with the J&J vaccine, which has since been no longer being used in the United States. So because we are doing continual research, we are monitoring side effects, we're monitoring complications. We are, if we see things going down the path that we did not anticipate, then adjustments are made. However, we do have to make sure that people do recognize that some of those side effects that develop, you can get those complications significantly higher if you get the actual disease. Yes. Take, for instance, the COVID vaccine. So, you know, there was a risk of getting inflammation around the heart, or if there was a risk of getting a blood clot. Well, the risk of getting a blood clot or inflammation around the heart, if you have COVID, will significantly increase. So again, we have to look at benefits versus risk. And so again, are we here to say that no, you won't get any side effects from vaccines, or that you may not get any unwanted effects from vaccines? Yes, that could happen, and it's been very transparent. But you have to look at likelihood versus
potential versus likelihood.
Potential versus likelihood. What is the potential of me getting this side effect or complication? What's the likelihood of me getting this disease and dying and having significant complications?
Yes.
You know, when both of you are talking, I got in my head about something. One, I know because I have people in my family that work in the hospital, all in and around the hospital, and they say sometimes physicians have a tendency to treat the disease and not the person. And so I come back to what you said about clinical trials. Let's stay on that for a minute, because there is a fear in some communities about participating in clinical trials from the history of being exploited.
Yes.
But clinical trials, as my understanding, are very important because without clinical trials, you then don't see those, you don't get those sometimes very elusive communities that carry on those hereditary high sugar. They used to say that back in the day. You got the sugar, diabetes. You know what I mean? You got high blood, you got the pressure. You got the pressure. But we don't go get tested because we're fearful of being exploited. So I guess what I'm asking you to really go through, I'm a layman, you're professionals. How really important are the clinical trials and how have you seen them really progress over the years?
Clinical trials are extremely important because research is what drives medicine. So the research that's being done today will tell me which medication I should be using for asthma in 5, 6, 10 years. Same thing for diabetes, same thing for high blood pressure, same thing for heart disease, same thing for thyroid problems. So research is absolutely what drives medicine. However, before you can go out and say, this medicine, we're going to give it to the entire population, you really have to study it.
Okay.
You have to study it. And oftentimes research will start off in animals, then they will move from animals to humans, to human trials. And people have to agree to participate in the research. So there's something that has changed in research over the years, something called informed consent.
Okay.
You cannot be signed up for a research trial without your consent. But two, also, when you consent, you want to know what you're consenting for. So when people come out and ask you to participate in research trials, one, it should be a trusted messenger who's coming out to help provide that information, right? If a big hospital system is coming down to a community and they haven't really had a connection with the community, it's going to be hard to get people to sign up for their trial. So you really need to partner with a community partner that the community trusts to come in and have a conversation with them, make sure that their questions are appropriately answered. But again, informed consent. You cannot be involved in a trial without your consent. But also, and if you join a trial, you decide to drop out, you can do that also. But also what is important is African Americans historically has not joined clinical trials, again, because of the mistrust,
Fear.
the mistreatment, the fear. But what happens when you go see your doctor tells you about a new medication? Doc, tell me about this in black men. How does it work in black men?
Right.
Well, Brian, we don't know because we didn't have a lot of black men in the studies. So now all we could do is give you the information based on white men, right, who signed up for the study. So it's important for us to be involved in these trials if we really want the data to reflect our communities. But in order to get us in those trials, we need to feel comfortable being a part of the trials. So there is a whole litany of things that has to happen to get people to sign up for clinical trials. But make no mistake about it, research is absolutely needed to drive medicine forward.
I remember when we we entered medical school. Oh, that was in fall of 1996. And the first day of school, our first day of class, our professor said to us, 50% of what I tell you today will not be true when you graduate in 4 years. Because medicine, yes, because medicine changes. And this is why research is important so that we can, you know, they say when you know better, you do better.
Yes.
That is the only way that we can continue to know how to continue to treat this complicated human body that God has created. We don't know everything about it. We still don't know everything about it. So we have to continue to do the research so that we can continue to learn, you know, what works, what doesn't work. So research is absolutely important. But to Dr. McDonald's point, you have to be inclusive. In order for you to be inclusive, you have to make sure that you are appropriately addressing patients' concerns, because a lot of times when people are hesitant, it's because there's a question or concern that has not been answered.
Right.
And so we have to make sure that we are giving them the information.
Information is so important. I'm sitting here thinking about, you know, so many different drugs out there now because they're kind of just falling out of the experimental, use at your own risk kind of disclosure, that if you participate in some trials that offer you a discount on the medicine that is normally not really covered by your insurance. That's happened to me a few times, and then each time I got kicked out of the trials because I didn't fit the criteria. Again, it's always about me, right? But I was willing to encounter the conversation because I thought, okay, the insurance company has made a decision. That's scary too. When your insurance company says, no, we don't, the insurance company backs you up and says, no, we don't believe in this medicine, that you don't need it. And now they give you this whole pamphlet as to why. And sometimes it's contradictory to what you want to believe into that trusted source. Okay, well, the doctor said, if I use this, but is the insurance company trying to get over? Or is it a drug you don't know anything about? But then some insurance companies come back, some pharmaceuticals come back and say, hey, this drug is still kind of being tested out, but if you participate in this trial, we'll give you a discount on it. So you kind of stuck on the corner of walk, don't walk. What should you do? You don't really know. But if we participated in more of the trials as a community, things like breast cancer, for instance, that, years ago, and you guys, you gave your example at the top of the show, how your grandma passed away when you was 8. We didn't talk about it. We didn't really talk about any illnesses. We didn't talk about Alzheimer's. We dismissed it that it was senility. You was senile.
Yep.
Oh, grandma never said this. She just old. She's senile. She's senile. So-and-so mom, is just sick. She got a whole hysterectomy. We didn't know. We didn't talk about it. We didn't share that experience. It was kind of like, and I think that covers the gamut of race, social class. I think people just are really protective of something they don't know anything about. So the best thing you can do is keep it a secret. It's a secret. But when it's a secret and you don't share the information, you don't find yourselves sharing the side effects. You don't hear yourself, really weighing out your options because you don't know what to ask as options. Yes. And then, because I can tell you, having conversations with older men and men my age, we all sit in a room, and we're not talking just about football anymore. We're not talking about basketball or who's going to get the draft and that kind of thing. We're talking about your sleep apnea machine. We're talking about, did you go out and get your colonoscopy? When's the last time your prostate been checked? You don't have a urologist? Well, it's not like it's vogue to do it, but now, okay, somebody else has done it, and so it's kind of like, okay, it's all right. Same thing I think is going to start to happen with clinical trials. But when we talk about modern medicine, what do you feel are some of the positives and negatives of AI? Dr. Wardlaw, let's start with you.
So AI is here. Artificial intelligence is here. And it's already embedded in the medical community. So with AI, it helps you move quicker sometimes in instances. It helps you to generate, your notes. So, doctors, we have to do our charting, and charting takes a lot of time. So it can help to reduce those times. But it also helps with the hospital use algorithms as to if a patient is going to be admitted, if they're not going to be admitted. AI has been being used for that. Oh, wow. Yeah, right. And so AI is being used to be able to help things be done in a little bit more of an efficient manner. However, what we have to be careful with AI is not to generalize. We have to still make sure that we are treating patients individually and not, just grouping things together in a generalized fashion. But AI is here. It is, and there's no walking away from it. And so we just have to make sure that we are using it appropriately in our practices. We have to make sure that we are using it appropriately with our patients. Our patients use AI, and so we have to make sure that they are using it in a way that they're getting accurate information. And because the misinformation is just
out there.
The misinformation is just rampant. And so AI is useful. We just have to make sure that we're using it in a way that we're not losing the individual treatment plans for patients. Yes.
So it comes back to, again, are we treating the patient or the disease? And is it going to be coded down? You got to kind of really guide the algorithms. Yep. Because everything is kind of guided by the algorithm. If you go out there and you say, you like to do line dancing on social media, next thing you know, you're getting all kinds of clips and reels about line dancing. Yes. You're like, wow, how did they know? How were they smart enough to know that I'm interested? Or if you like scary movies, or if you like the theater, or you like certain artists, or certain concerts, or something, anything like that now is developed and built on the algorithm. So it's always interesting to hear people, kind of dream the dream of AI. I don't know if it's going to make us any more comfortable. And I just told a young medical student that is first generation. I taught the first generation college students, and it's probably going to strike a chord with you, so I'm going to move over a little bit. I said to him, I hope medicine doesn't make you colder. I want your heart to stay earnest. And what I meant by that is sometimes doctors, physicians are forced to manage people's chronic illnesses according to their means. You know, so if you don't have a whole lot of insurance, if you don't have a lot of electricity in your home, if you have homeless insecurities, you know, there's no way for you to take home sometimes durable medical equipment. You know, sometimes that I don't want to say it makes you cold, but maybe it hardens you because you're seeing patients that you can't fully help.
So that goes to the social determinants of health.
Come on with it.
That's exactly what you're talking about, right? So when we're talking about practice in medicine, you have to understand your entire patient. You have to understand, if you're going to treat them medically, you have to understand their situation. As you said, if you have a patient who has chronic sleep apnea, you're sending them home on a CPAP machine. If it, you know, you got to plug it in, they have issues with where they're going to sleep at nighttime, too, right? One, if they have a house to go to. Two, if the house has electricity. So worrying about those things, you have to, so as Dr. Warlaw just said, you have to look at the patient in front of you, and you have to figure out how to make sure they get the things that they need. I mean, such is very simple for me. You talk about durable medical equipment, but even in the field of pediatrics, when I tell my patients, I need you to send your child outside to play. Let them ride their bike, let them jump rope, let them go play basketball. Some of my patients will say, Doc, not in my neighborhood. I can't do that in my neighborhood. And I take a step back and say, okay, you don't feel comfortable with your child going outside. Okay, let's see what we can do in the house. Right? So you have to understand. Dr. Warlaw always have a saying. She grabbed the saying from somebody, I grabbed it from her. Know your hood. Know who you are working with and who you are taking care of so that you can help address their needs. If people say the patient is non-compliant, but maybe they're non-compliant because the bus didn't come. The bus was late, so they missed their appointment. Or, you know, during COVID, we said only the child who could come in you can only bring the child who's sick. But everybody's in virtual school, you got 3 other kids at home. How are you going to manage that? Right? So you're worried about catching the bus, but okay, you need to load up that septic key card, but you're trying to figure out how you're going to eat, right? So, or pay the rent, or pay the electricity, as you said. So all of those things, social determinants of health, you have to understand the patients that you're taking care of.
And it goes to even patients with medications. Some patients may share their medications with their family members. Some patients
There's a lot of that going on.
Some patients may go to every other day because they're trying to stretch the medication. Some patients may choose not to get one medication or get the other because they don't have the finances to do that. And then some people are not comfortable with sharing that with their doctor. And so again, we have to take the lead on that and say, hey, are you taking all your medications? And some patients are still will still withhold some information and say, well, yeah, I'm taking it all, but I'll say, well, hey, your lab here says very clearly that you're not taking the medication, so let's talk and figure out, is it because you're having a side effect? Is it because you can't get to the drugstore to get the medication? Is it because you don't have the funds to get the medication? So you have to be able to address the non-medical issues that can have a significant impact on a patient's health. So you brought that up very clearly, Mr. Green.
And sometimes as doctors, it's like, okay, this mother can't pay her rent, or she's homeless. Okay, how do I help her now? So now you have to try to pull those resources to help them. So, you know, there's this, as people say, there's levels to this, right? And you know, trying to help people get the things that they need. But more importantly, where it starts at is that as a physician, we have to make our patients and their families feel comfortable enough to say, Doc, this is why I'm not taking my medication, or this is why I'm not doing what you asked me to do. And once we know that, we can try to work with you, right? So, in the best means possible, right? So,
and that's why cultural competency matters. So you have to understand the culture that you are serving. And so that applies for me if I work in a community that is a non-African American community. Right now, my patient population is predominantly African American, but if for some reason I relocate and I'm servicing another community, that is my job to recognize what the challenges are that they're facing, because again, that can have a significant impact on their health.
Yes.
Wow.
Yes.
All right, I think we're going to take a quick break, and we're going to come back on the other side and continue our conversation with the twin sister docs. Who was first? Who's the older sister?
I am.
Okay.
I'm 15 minutes older. Let's just be clear about that.
That's our claim.
Let's just be clear about that, Mr. Green.
Okay.
That's our
okay.
claim to
15
fame.
minutes older, okay?
That's our claim to fame.
Do not go away. We're going to come back on this conversation.
Did you know?
Hi, I'm Elizabeth Green. I'm a retired nurse, and Always Best Care takes care of me in my own home.
Hi, I'm Brian Green, the owner and CEO of Always Best Care. We service southeastern Pennsylvania and the entire state of Delaware.
Do you want them to know that I'm your real grandmother?
Yes, Chubby, that's the point.
Should I tell them the time when you were 7?
Love, no.
I could stay in my own house and get all the help that I need, and I tell you that all the time.
You see, I trust my people with my grandmother, and you can trust us with yours.
When it's time for your loved one to move into a new home, it's tough to know where to find answers, and you may end up in a web of defeat. Don't worry, we can help. At Always Best Care, we understand your needs, and our trained experts can arrange senior living community tours, provide guidance on care, budgetary considerations, and help educate you on the amenities of each location. Think of us as your complimentary personal concierge service. So when it's time to find a new home for your loved one, we make it easy for you to focus on what's really important. Contact us today.
Did you know? Come on, listen here. Did you know?
Welcome back to the Did You Know Show. I am having the best time with the twin sister docs. They have become really good friends in the community, and I watched them and I stalked them on social media. I'm just going to reveal it now to see what they're going to do next. I want to talk about your mentoring programs. Can we get to that?
Yes.
Go ahead.
So, Dr. Warlard and I, as African American females, we are 2% of the physician population in the United States. And our goal is, we're not going to be doing this forever. Father Time is catching up. So
it's undefeated.
It's undefeated, as they say. So we want to make sure that, you know, we are encouraging more African American, other children of color to come into the field of medicine. And of course, we love for them all to be physicians, but, you know, nurses and respiratory therapists and pharmacists, and, you know, there's so much in the field of medicine and, you know, STEM careers in general. So our goal is to spark the mind. When we were younger, we didn't see a lot of African American physicians.
Right.
So we go out into the schools and we talk to the kindergartners and the first graders and the seventh graders and the eighth graders. We go to high schools. We go back to Deer High, you know, talk to the high schoolers. We even talk to college students. But our goal is to show people, one, that we exist. We're alive and live in color. We come from very humble means. So you can absolutely do this, but people need to see it. Representation absolutely matters.
I completely
agree. So you need to see it to know that it is a possibility. So that is why we go into these schools. We have a program called Be Bold, Be Healthy, Be You.
Hey.
And we talk about everything from physical activity to healthy eating, to mental health, to proper sleep, to social media etiquette. We talk about all of those things because, again, our goal is to give the children information. Hopefully it'll take it home to their parents so that we're impacting communities. But they're also seeing Dr. McDonald. They're also seeing Dr. Wardlaw. They're also seeing Dr. Johnson, who comes with us. She's a pediatrician. The registered dietitian who comes with us, you know, she is African American. Or we bring chefs in that are African American. So it's about exposing people to, and really our children, so that it sparks the mind early, so that they can start to think that, hey, I can do this, right? And our little girls, we got to get them into STEM. We have to get them into STEM. So
I'm stuck on 2%. 2%.
Yes. Yes.
2%. Wow.
Yes.
Especially nowadays when you think about all of the demonization of DEI.
Yes.
And you know, for me, one of the most proudest moments for me as a African American man, black man in business, is that I've been able to create a multicultural environment. But what has become apparent more and more is that the workforce in a lot of ways is intergenerational.
Yes.
I have people that work for me that are 18, and I have people in the 80s
Yes.
that work
Yes.
for me. And it's funny you said, Father Time. Father Time is undefeated. But what we say in my walk of business is that nobody is an expert at getting old. We only go by this way but once.
Yes.
So the mentoring programs, I love that. I love that you're in the schools. I love that you're out there, doing things and really evangelizing the brand. But also, you're right. I completely agree with you. You have to see that. You have to see it. You have to talk about it. You too can be a physician. You can be a doctor.
Yes.
We used to play doctor back in the day. You used to play operation. Used to be a game. Now
Yes.
people don't play operation no
Yes.
more. I don't even think they sell. Well,
They still do it. They still do it, but
okay.
they have them in different little, based off of shows and things like that.
Yeah.
Operation's still out there.
Okay. So another exciting thing, and when we talk about you guys evangelizing your brand, is your podcast.
Yes.
And just tell us about it. Tell us about the podcast.
So our podcast, it launched in February of this year,
Okay.
and our podcast is another way that we can reach a broader audience. And again, give people information who may not otherwise receive it in any other form. And so those who are hesitant about going to the doctor, those who are hesitant about asking questions at the doctors, those who are hesitant about following up once they get a diagnosis or once they get the information that they need to start medication. So our podcast is to help people, give them information and tidbits on how they can navigate this complicated medical system, because it is complicated to say the least. And also to give them information on conditions that commonly affect our communities, and also to debunk myths. The misinformation is just
Rampant.
It's massive. It is massive. And misinformation can be dangerous.
It can be deadly.
It can be deadly. And so our job, a part of our podcast is to make sure that we are providing this information. And you can get it on, Spotify, YouTube, and we drop a new episode every other Monday. This Monday we will be dropping our next episode. And so we want people to tune in and be able to get information, and they comment and send us questions or concerns. And we are not your specific doctor.
Yes.
We have to put that out there. Disclaimer, we're not giving out specific medical information, but we're giving you general information that you can have that conversation with your physician and be engaged. Because the bottom line is, as the patient, you're the captain of the ship. And it is a team approach, but we have to get the patient has to be comfortable with following the recommendation, the guidelines, or we're not going to have the benefits of the treatment that we're looking for. So again, we need for patients to be the captain of their ship, and we'd like to give you that general information so you can drive it.
And the name of our podcast is called The Twin Sister Docs Podcast. So certainly listen, view, and subscribe to us to get all the wonderful information.
I'm thinking about the podcast in general, and and you bringing knowledge to people. You have so many commonalities and questions. When I think about the misinformation, and I'm not again, full disclosure, I'm not a physician, but when I hear things that just don't make sense, like they had people taking horse vaccinations for COVID. They had people talking about but there's now measles outbreak that we're dealing with. Now they're telling people to take vitamin A.
Yes.
Like, the misinformation, people sometimes believe what they want to believe because it's power in being a trusted source. There's power in that. And it's also very dangerous if it's the wrong kind of information. You want to really use your common sense. You said something earlier that just laid on me, because I am a parent of a child that had additional needs with vision. And so, and because we had a difference of opinion when it came to, I'll tell you what it was, public school versus Catholic school. Her mother went to Catholic school for years, and I went to public school. And so that was the beginning of the end in terms of an argument when we decided to mainstream her in school. But when you're considering all of the options, it's not necessarily the school so much as how is your child, or your person going to thrive. Everything we talked about with the social determinants, when we talk about the misinformation, when we talk about participating and having a proactive, I say it again for the people in the back, a proactive conversation with your physician, and give them grace. When they run a little late
Give
behind,
us a little grace.
Thank you.
don't be in there thinking to yourself, I got to get out of here. Because a lot of us go to the doctors. I used to go to the doctors. I couldn't wait for the appointment to be over. I used to work myself up into this white coat syndrome.
Yes. Yes.
Oh, my goodness, what is this going to be about? But I'm here to tell you, when you have two beautiful doctors that are friendly, and they're not making pretend because the camera's on there. I really watch them out there on social media. I'm cheering you on from afar. I could not wait to get you on the show. You've been on the radio show. What's next for you? As we wind down the show, what's next? What's your wish list? Give us your wish list as we wind down the show.
So our wish list is to, one, expand our outreach.
Through our foundation.
Through our foundation. We do have the Twin Sister Docs Foundation, and again, that allows us to be able to provide resources to students who are interested in STEM or who are not interested. We're trying to get them just exposure. We're looking to start our Science Academy, which is an academy where we allow the children to come in and do interactive, hands-on things with, anatomy models and body parts, and looking at disease processes and looking at what the body looks like in normal state, so being able to get our Science Academy going. So we're looking at that. We're doing that through our foundation, going out and just having those interactions because, again, the representation matters.
So Dr. Wardlaw said it best. Our foundation is to continue to increase healthcare advocacy, to mentor and spark the minds that are coming between us, coming behind us. So look for us on our podcast, the Twin Sister Docs podcast, and look for us, the Twin Sister Docs Foundation, and you can certainly donate to the foundation so that we continue to do all these programs. And look for us on all social media, Twin Sister Docs, Instagram, Facebook, Threads, and our website, thetwinsisterdocs.com.
Wow, this has been probably one of the best shows I've done in a very long time. One, it's been inspirational on the level of being, I know you guys are physicians, but in some ways you have that entrepreneurial spirit. And you're engineering and you're not afraid. Sometimes we get afraid, after success, we get afraid to come back to the community that we're from because we're afraid of rejection. We're afraid of not being received. We never want to be in a position where we're talking to people, talking down to people. We want to work. You said it at the beginning of the show, and it just laid on me, inclusivity. It's a difference from being invited versus being included.
Yes.
Okay, this has been my show. This episode, we're going to close it. We're going to have them come back. Check us out on WRD Radio, 96.1 FM or 900 AM. The Did You Know show has been sponsored by Always Best Care Senior Services. We provide in-home care, primarily to seniors, but if you're somebody that has had a hip, a knee replacement, a back injury, if you're recovering from a stroke or battling cancer, please think about Always Best Care first. And we're hiring. We're always hiring. Check us out at the website, teamgreenabc.com. I know a lot of y'all are looking for a job, but if you want to come out and work in the home and community-based space, check us out. Thank you and peace.
Did you know he'll help you understand? Did you know